going on, Future DDS family? We are here today with a new series. We are talking to a new dentist. Here we have Dr. Jordan Barnett, man, one of our longtime Future DDS friends and you know, friends of the platform. He's been here. He's actually done an interview with us before, and he is back to tell us his experience now that he's actually transitioned into being a new doc. So, you know, without further ado, I'll allow Jordan to introduce himself a little bit more, tell us a little bit more about his journey, where he went to undergrad or where he went to dental school. And then, you know, we can get into the conversation. So Jordan, you can go ahead and reintroduce yourself, please.
Perfect. Hi, everyone. My name is Dr. Jordan Barnett. It feels weird to say that, but it's been 8 months and it still feels weird. But yeah, I'm here in Fresno, California, where I grew up and born and raised here. I went to Fresno State, and now I'm actually serving on the Fresno State Alumni Board, actually, which is really an honor and a blessing, as well as, you know, seeing multiple patients, you know, every day throughout the various jobs and stuff like that. So things are good. I'm looking to get married pretty soon. Like probably, yeah, like next month. It's a whole COVID story. We can get into that later. But yeah, no, things are great. My life is going well, and I'm blessed beyond measure. And I'm really happy to be here with both future DDS members here, and just really want to take the time to applaud them for the effort that they've made so far, as well as the opportunity to come and speak with all of you.
Awesome. Thank you.
So you are a great source of information, because in this day and age, we feel like the idea of residency was kind of, you know, pushed upon us, you know, especially with COVID,
Sure.
which is somewhat understandable. Exactly. It is understandable. But to meet somebody who is, you know, a strong supporter of going to work, you know, it's always good to kind of hear that peace of mind or whatever, that perspective. So if you can kind of break down why you chose to, you know, go ahead and hop right into the working field instead of pursuing the typical AEGD or GPR.
Definitely. You know, look, I'm a huge fan of doing what is best for yourself. If you're smart enough to get into dental school and you're smart enough to graduate dental school, then you should be smart enough to figure out what your deficiencies and sufficiencies are. For me, I really treated my third year as my residency. I went to UOP, so it's a 3-year school. And I really took every single ounce of every second to be like, okay, this is exactly what I want to do. Sometimes that didn't always align with, you know, my assignments or school things. And I'm not going to act like I was the best student. UOP was a tremendous school, and I have nothing but good things to say about University Pacific. But for me, I was really, really honed in on wanting to get to work. I went to the 3-year school because it was supposed to guarantee me a year out. And great, I wanted to take every advantage of that as possible. For myself, I had to borrow maximum loans to go to dental school. So money was a huge concern. And it's honestly true, you get paid a whole lot more to go be an actual associate dentist or whatever you want to call it versus a resident. So that was number one, huge. Second, I had some experience in a residency. So I volunteered for 2 years at there's a general practice residency here in Fresno. And I got a lot of time to spend with the current residents and kind of see what their goals, motivations were. This is prior to going to dental school. And then not only that, my senior year of dental school, since I lived so close to that GPR, my fiance who owns a home here, she actually rented out a room to a girl from the class above me at UOP. So again, so she was living my senior year of dental school with a GPR resident, and kind of seeing the experiences and the things that she got. I didn't really understand how relatable that was to me as someone who wants to be a private practice owner. Right. And so I wanted to really spend all of my time focusing on things that were as relevant. Now, it's general practice residency. Isn't it all relevant, or advanced education, general dentistry? Yeah, sure it is. You know, but at the same time, a lot of it felt like school to me, if I'm just being honest. And again, I really spent my time focusing so hard on being a good, you know, senior student. And again, like having that mentality of this is my residency, my last year. I basically am a dentist for the school, right? My third year. And so I really took advantage of that. And lastly, the mentorship part, I think, is really important. I think there's a different level of mentorship that goes into, hey, yeah, come work for me in my practice that I built, that I'm responsible for, me being the owner dentist at this point, versus this is my residency and I'm a faculty here at the residency. So I felt like when I really looked at it, just from a practical standpoint, I wanted the best mentorship I could. And so if I have just one single owner doctor whose whole name and reputation is based around me being there, they seem to have an extremely vested interest in my success and me doing well. And again, as a new dentist, I want to learn. I want to continue to expand my skill set and grow. And working with people who want to sell their practice, pretty sure they have a really vested interest in me. Maybe or maybe not more than you would find at a residency. Again, for me, it was a pretty easy choice in terms of the money. That was just an absolute necessity for me. But again, as well as the other benefits that I included. And to be quite honest, a lot of these, especially GPRs, you're on call, things like that. Again, I lived with someone who was on that because, during my senior year, it was COVID, and our roommate was here too. And I would see how much you'd go on call, and like, just honestly, to me, that just wasn't very appealing. Okay. Especially when I didn't feel like there was a huge net benefit in terms of skills added and skills gained. And so now look, are some great? Yeah, I have some classmates that are in some and they love it. Again, it needs to be individualized towards your personality. For me, I felt like I had the personality to go straight in, and it's been going well so far, and I'm very happy with my personal choice for me.
So quick question. You had spoken about treating your last year or your time in clinic as your own residency. And so like, can you kind of elaborate on how you went about doing that? What was those extra things that you did in order to kind of enhance your dental school experience compared to, some of your other classmates? Like, what exactly did you do in order to, reach that higher level of preparedness, I guess?
Sure. I think that's a great question. Obviously things have changed because of COVID. So let's bear that in mind. But for me, what I did is, okay, so let's say there's a difference. Do I have a patient or do I not have a patient? Let's go with I have a patient. If I have a patient, for me, I took pictures of everything in dental school. Now, your dental school may or may not be different. For us, we couldn't have our own camera, but the school had intraoral cameras and had high-grade professional cameras. No one really seemed to use them because, as you know, you're a dental student. There's just so much to kind of figure out. Start checks, is this patient okay? Is the P-star removed if you're using Axiom? God, I don't miss that. Right? All those types of things. And for me, so what I did is I really, really took advantage of like, okay, every appointment was just like my absolute time to be like, okay, I'm going to soak up as much time as I can. Now, for me, what I did is I took a lot of time actually going out and marketing myself. Our school gave us business cards. A lot of my classmates, like took pictures, on Facebook, hey, I'm a dentist, whatever. Like I gave out all 1,000 of mine, right? And with that 1,000, I was able to get about 25 patients to come see me at school. So if anyone thinks that they can't do it, like my success rate was 0.25%. So if you can beat 0.25%, then there you go. There you go. And so again, what I was doing sitting there is I took every advantage of, of every opportunity I could. There's definitely more that I could have done, but I'll kind of break down what I did. So if I had a patient, again, it was basically a photo studio in the operatory. I had everything ready, every single step, whether that's So these are the photos I would take. Let's say I was doing a prep. Let's say I was doing a number 8, class 3, right? Then I would take a picture of presentation, right? I would take a picture with the marking paper and centric. Okay, do they have centric contact? No, yes. All right. Then I would take one of excursives. Okay, left, right, and then protrusive. Right. That way I can see, because again, I want my restoration to go with that. Right. Then I would take one of the prep, and I would take one of the isolation, because that's important too. Like, what matrix system did you use? Did you use Mylar? Did you go Toffelmeyer, et cetera, et cetera? Of course, when you're assisting yourself, that's a lot more difficult. Right. But again, and again, you have 4 hours, 3 hours to do it. It's like, that is your chair time. And what I mean by your chair time, it's you are paying tuition to use that chair. I can't go to Tufts right now and be like, hey, you guys got a chair I can use? Like, no, because I'm not a student and or faculty, and I didn't pay tuition and or I don't receive a paycheck from there. So that is your chair. And if you have it reserved, I spent every minute that I could. Obviously, I would speak with my patient before and say, hey, do you have to go anywhere? This could take 3 to 4 hours. And of course, I would always preface, like, you have to be present for the entire appointment. So, and then the last pictures I would take is obviously final, and then final with the marking papers too. So now if you think about every single preparation I had every single step of the way photographed. And what I did with those photos is I would look at those, I would create a portfolio, which I highly, highly recommend. If I can leave one tip for this whole video, it's having a portfolio, and we'll get into that later. And I'll also link my portfolio so people can see it's live and updated. And that's honestly why I was able to get jobs. So there you go. But yeah, and so I would have those, and then what I would do is I would sit there and I would analyze each photo after. right? Like look at your prep. Yeah, maybe you saw your prep through 3.5x loose, but it's like, okay, how about on a high resolution camera zoomed in to where you have the entire screen is like half a millimeter. You can really analyze your prep and really find certain things, almost very similar to like a CEREC or anything that you try to scan. I'm basically doing that with just high quality pictures, right? So I would do those things. And then not only that, I would be very upfront with patients like, hey, look, like I'm learning, you know, this is a school. They obviously get that. And it's like, I would really appreciate your feedback. And what I would do is I would even go on, I didn't do it as much as I would have liked to, but like you can go on Google Forms and type in like a feedback thing. If you have an iPad or a computer, just have them fill it out. No one has to see it. It's just for your own thing. And say, hey, you know, I'd love to hear that feedback. Did you like that? How was the anesthesia? Was it comfortable? Where's all these things? And so I really took all these bits of data that I collected myself from my patients, so that way I could utilize that for my own learning and education. Lastly, if I didn't have a patient, that's where it really got interesting. So what I would do is, if you think about it, the student to faculty ratio at UOP is usually 3-1 on the floor. So it's like, okay, let's be honest, what are these faculty doing the most of the time? They're usually just sitting kind of waiting for a start check. So it's busy in the beginning and maybe busy at the end because people are trying to get swipes for notes or whatever. But like the majority of the middle time, they're not doing anything. So I would tell them like, hey, you know, look, I want to go into private practice. I really want to get going. And for what I notice in my now 8 months of experience is that the diagnosis portion is the part where you're really like doing it quickly. And you're sitting there like, wow, this is a crown versus a filling versus an extraction versus a root canal. Those are big considerations. You're making those so quick in real life. And so I was like, okay, well, I want to get good at those. So I said like, hey, would you mind if maybe we just go operatory to operatory, just look at the radiographs. We don't have to look at the patient. And can I just tell you what I see and what I think I would do? And I would just love to hear your feedback based on that to the faculty. They loved it. Again, I'm paying for education to go there. Why not? So it's like, yeah, I would go and there'd be 18 of my classmates in a certain section. I'd be like, okay, so let's go to the first one. Let's look at the bite wing. Okay, here I see an E2 lesion. Now looking at the rest of the radiographs, I see that this is a high caries risk patient. We would take things like, we would do a lot of the Cambra, so caries risk, yeah. So we would do a lot of those types of things. So I would look at that data and say, okay, I see that this is a high caries risk patient. It's an E2. Normally, I don't feel comfortable doing E2s, but looking at the patient's age, et cetera, et cetera, et cetera. And I would kind of give my justifications there. I'd talk about my matrix selection. I would talk about my prep design, all these different types of questions. And then I would get their live feedback. And I would do this with every faculty that would let me, you know, and with doing that, it's like, okay, great. So now I just, instead of in my dental school time, maybe I didn't have a patient, but I just looked at 100 different radiographs with 3 different dentists that I respect, honor, trust, and admire. And now they're all telling me, yeah, I agree, or I wouldn't do this. And then it's like, oh, why wouldn't you do that? And then I'm just sitting there like a sponge, like, okay, got it. And then in times maybe, you know, that I didn't have to be there, I would go and I would just ask to go shadow. I mean, I was in San Francisco, so there's some really, really impressive dentists out there in San Francisco. And so I would just call their offices, say, hey, I'm a dental student at UOP. Obviously, if you're in the same town as this dentist, they know your school, and say like, hey, like, do you think I could ever come shadow you or something like that? You know, no one's really going to say no to that. And then when you're in there, it's like, okay, great. You know, and you're just kind of dialing it in and just kind of thinking about like, what would I do? So I think that introspection and understanding of, okay, I'm going to be a provider without any ability to ask for help, because that's what I want to be. I want to be Jordan Barnett, DDS, by myself in an office. What are my best decision-making skills? And I can tell you that now in my 8 months of experience, I've been, I mean, you know, a lot of times in that same situation, I feel comfortable making those decisions and being able to stand by them because I had that experience. So that's how I treated my last year. I was very aggressive in that. And I mean, you know what else was aggressive was my tuition. So, hey, man, why not? Right?
Yeah, we're in the same boat, you know.
Yeah, definitely. Definitely.
So that was a really good recap of, you know, how you kind of spent your last year at UOP. I think and one of the biggest reasons why we wanted to do this, kind of figure out what that transition from day-to-day life in dental school practice versus day-to-day life in a private practice is like. So I guess if you could go through and just make some very, larger scale differences that you've seen between like your day-to-day within clinic at UOP and your day-to-day at the private practice that you're working in now, and kind of, if you could, go into what your day-to-day actually looks like now that you're out of school, if you're working in one office, 2 offices, different things like that.
Sure. So for right now, I have 3 different places that I work, and so that gets pretty confusing, and I won't confuse everyone there. But long story short, I work at a PDS office Monday and Tuesday. I work at 2 other private practices between Wednesday and Friday. And the reason for me doing that, yeah, I know it's crazy, and maybe people will think, oh, that's not something I can do. It's like,
it sounds like a lot. I don't know. You gonna let us know? It sounds like a lot.
It sounds like
it is a lot. It is a lot. But then when I think about, okay, when you're at Tufts, right, and you say you want to do a class, and I look, I don't know Tufts. I can only speak on UOP. And again, UOP did have some of the best materials, and I loved it. But also, I didn't get to choose my material selection. I didn't, I was not anyone's boss, right? I couldn't make these decisions. And not only that, the patient understood I was a student. It's far different. First and foremost, I think the biggest difference in terms of dental school versus in real life is the way patients talk to you is like, okay, you are the dentist. Mm-hmm. Now, if Tyler Brown is my student at, Tufts, if that patient goes to a party and said, oh yeah, hey, nice filling, someone's like, nice filling, like, oh, who's your dentist? Like, they're going to say Tyler. So I think that's something for dental students to not always, yes, I'm not saying to claim that, oh, I am a dentist when you're not yet, but understand and take the responsibility that's necessary of being someone's provider, because you are providing healthcare treatments to people, whether you're a student or you're not. That's one. And again, it's different when it's real advice and it's your professional opinion that's going out there, right? When, let's say, and maybe you guys, I think any dental student out there has come across at least one patient that has a complaint about the school, right? And or maybe some of their previous student dentists that they've seen before you, right? Now, remember, if you really, and when talking to those patients, I can almost guarantee they can never tell you the student's name. It's completely different when you're in the real world. No, because usually if you mess up, it is your name and they're looking for you. Remember, dentists are sued a lot. And I would like to not have that experience. Yeah. And so there's that also. And then, I mean, of course, yeah, it comes with speed, right? Like, I don't have 4 hours for an occlusal filling anymore. Now, maybe now I have, 10 minutes, right? And while that sounds crazy, right? Like, obviously the speed comes with it. But of course, like, if you have a good mentor and you have a good office, they'll understand your speed. You guys can grow together. But not only that, like, working with different assistants, working with different materials, right? And really being good at saying, like, remember, you're not in school anymore, right? I'm not copying the owner dentist. I'm just being consistent with clinical standards as well as clinical materials. So a lot of times, yeah, if you have, again, working with an assistant is huge. Now I have no idea how I did that in dental school without one, right? When you're like using your right foot to balance something else and you're doing isolation, you're trying to like grab this. Yeah, I don't do any of that anymore. I don't have time to do that anymore. But how is it different? It's I mean, other than it being dentistry, everything's different. You know what I mean? Like that's the only thing that's the same. And I love it. It's a lot of fun. I think the doctor-patient relationship is probably, I mean, I don't know. It's something that I feel humbled and honored to be a part of, but it is extraordinarily important as well as like, yeah, it's far more emotional, I think, than I thought it was, like, and you're having these quick emotional experiences. It's a lot more than dental school. Maybe you can think back to your first filling, your first extraction, and maybe, or your first difficult patient or bad patient experience at dental school. It's like, well, you can have like 20 of those in a day now. And it's just like, I think the emotions aspect of it is hard, while also balancing like, oh my God, am I sure I'm doing this right? Right. Yeah. Which is a lot. Right. And so, I don't know. I mean, just really being understanding of my, my time and my experience. And not only that, like really falling back on the things that you learned, because like, if you go to an accredited dental school, they're teaching you quality information. It's just, can you apply that and can you use that? And does it make sense? And I think that's the last thing too. The last difference I'll give you is, in school, really what you're learning about is failure. You're learning about the failure of a PFM. Oh, at what PSI does this material break at? You have this type of endo and it was filled X millimeters short or X millimeters long. What's the failure rate? They're taking IV bisphosphonates, right? What's the rate of getting, hemorrhage or whatever they're calling it now, right? And while those are important things to keep in mind, right? Like in the real world, you're in the real world. You're not in a laboratory. You're not writing a research paper about this filling or this crown. It's like oftentimes you do things that maybe aren't ideal, but they're the best for the current situation. And I think understanding and explaining that is huge. And yeah, everything's different and it's a lot better. And so no, there you go.
There we go. And just a quick follow-up to that, man. So just speaking on, you say you are in 3 different offices right now.
Yeah.
So how was that process of kind of discerning which offers you wanted to take, which offices you wanted to work at? Was it like a mentor situation? Was it one is for money, one is for mentorship? Like, I guess, how did you kind of work out the working situation that you have right now?
I'll answer that with understanding this is a Jordan-ism. Jordan-isms aren't based in fact. They're just my own personal wisdom and
That's
personal
what we're here
beliefs.
for, man. That's what we want.
Yeah, thank you. Well, great. I'm chock full of them. It was no different than picking a dental school, right? This is a huge decision, right? Like, this is the license that I always wanted to work under, right? That I always wanted to have the opportunity to have. So it's like, yeah, I want to feel good. Like, I want to be in the office and be like, yeah, okay, I can provide here. I can do well here. You can talk to the staff and be like, yeah, this is a team that I can join, right? Also, like, if they're looking to hire you, like, you should have access to things like a schedule. You should see that it's a busy schedule. Can they afford to even bring you on? Right? Because I think that's a huge thing. It sounds really great. It's like, oh, I can have Tyrell and he's going to do everything for me and I'm going to kick back and drink pina coladas. Like, well, is that what you want? I don't know. I don't know what each person applying for a job wants. For me, what was important is, yes, mentorship, the ability to speak and communicate with the staff that works well. I don't do well with lazy people. And so I really kind of try to sniff that out. That's kind of a personality thing for me. And not only that, like, I really took the time to interact with some of the patients and see, like, okay, this is a patient population that it's accepting of me. I'm young, right? You have to know who you are. I'm 5'7", I look 12. And those don't necessarily add up to a competent dentist the first time you see me. So I think there was a lot there that I had to understand in terms of, is this the place for me, and will patient, because what I want is, I want the best patient experience. And if my looks or whatever it is about me, right, isn't something that the patient pool like is warm to, then it's like, well, am I doing them a service by being here? And does it even make sense for me? Right? How can I succeed in a place where there's factors here that I can't succeed with? And that, as well as, shadowing the owner doctor, right? Watching and saying, like, hey, do you mind if I shadow you and watch? Look at the materials that they're at. Look at the bite wings, and the x-rays when they're doing an exam, and be like, I agree with that. Or like, nope, absolutely not. No way, and not a snowball's chance that I would work here based on their over treatment or their far under treatment. And so I think there's a lot of factors that get into that. And I think that's a huge can of worms. But really, I think that's important. I think your gut instinct is important. And I think, like I said, if you're smart enough to graduate and become a dentist, I would hope you're smart enough to understand, like, this feels right. I like this for me, or I'm going to have to take a pass on this. And just understand too, like, yeah, maybe it's an awkward conversation. Maybe the dentist is really looking forward to having a day off because you're there, but it's like, are you going to be able to do good dentistry, especially coming out, if you're not comfortable? I would argue no. So
okay. And so from getting to know you over the years, you seem to have you seem to put certain systems in place in order to predict your success, right? Or
Sure.
ensure your success,
Sure.
I might say.
Sure.
So, with working at these 3 different offices, or really just your entire experience as being a post-grad, what have you done that you feel like has kind of, like I said, ensured your success thus far? Like, are there any like habits that you kept up with? And I remember last time we spoke to you, and this was a private conversation, but you brought up a portfourfolio. So
or a journal. I think it was a journal at the time. Yeah. Like a daily journal you were keeping or something.
So like, what are your things that you do today that, help you say, you know what, I know I'm getting better. I'm glad I'm making this decision. I'm going in this way.
Yeah, that's a great question. Thank you. And yeah, I haven't really kept up with the journaling. I haven't done a lot of those things. But what I've really mainly more done is, like, I have open lines of communication with the people that I work with. I am the junior dentist, or the line that I've now adopted is, I play a good Robin to a good Batman. Right. And so I have a very good open line of communication with the senior dentist to me. Right. And so, because we have technologies like intraoral cameras or things like that, I'll take pictures of everything that I do. Right. And actually, one office, the guy does the highest quality of dentistry, like Christopher Shamlin. He's an amazing guy. And so, like, yeah, like, he takes, even though he's 10 years out, and he does dentistry that I just like, like, for their office, they take post restoration bite wings. just for an insurance thing. And like, yeah. And so I've kept up with that. And I've also taken, you know, the intraoral photos of the prep and everything like that. And so that way he can see, because to me, it's like, if I'm going to collect a stent from any place, it's like, well, I want to upkeep my standards as well as mirror and, or even do better than, you know, the quality that is done, you know, by the person that I'm with. Now, sometimes obviously due to a skill, maybe I don't have the skill that they do, but that doesn't mean that I can't have good quality. Right. And so maximizing things like, you know, using patient technologies, not only that too, like, I think the biggest thing to success is really showing humility and treating the entire staff really well. I think really does serve you well, because again, no one wants to help someone who's mean.
Right.
No one wants to help someone who's mean. And unfortunately, I understand, like, you're now being granted the name in society doctor, and that really does change people into James Bond villains, it feels like sometimes. And I think that's horrible. I think that's wrong. And I think what it does is it really goes against what I hope to do, is create and ensure, you know, patient success. Because I mean, yeah, if I'm a patient, like, well, who are you? I don't care if you have some fancy overpriced degree. It's like, you're a jerk. Right. And so I think by and understanding the dynamics of an office, you know, a lot of the places I work for, it's just a single owner, then all the staff members who are non-dentists. And so the dentist is like, oh my God, the dentist is here.
Yeah.
Right. And again, the ones that I work with, they're really humble guys too. And by me coming in and saying like, look, you know, like, what I see in front of me is over 100 years of dental experience. I'm looking to gain and grab every bit of information that I can get from you. It's like, idea is king, not the person who had the idea. So it's like, show me the ways. Like, okay, let's say Dr. Brown was my mentor. It's like, okay, I'm an operatory. Maybe I haven't had this before. It's like, what does Dr. Brown use? And I'll have a very clear understanding with my assistant. Like, give me the material that he would use here, and or he or she would use here. And it's like, I'll look at it, and if it works, it works. If it doesn't, it doesn't. And I'll use whatever I like, and I'll kind of mold myself there. Not only that, I talk to the front office staff. Hey, talk to the patient. Give me the feedback, especially the bad feedback. Tell me what they said. Was it too long? Was it uncomfortable? Right? What are things I can improve on? And I think by having that humility and that coachability, right, and then also carrying on those conversations with the mentor, I mean, yeah, like, I'm getting live actual feedback from the patient, right? As well as the feedback from my staff, as well as the feedback from my mentor. And it's like, that's more data than most people can consume, but it's like, it's enough to keep me updated and to understand, like, okay, this is where I'm at, right? Because I know where I want to be at. And you can look also at a schedule, you know, if you fell behind, you know, if you didn't do a great job. And I write down the things I didn't do a great job at. You have to write notes, and I'll write very, you know, very good notes for myself. That way, when I come back, it's like, okay, I remember that.
Mm-hmm.
I remember that. Yeah. Got it. So yeah, really that, and just communication. I think it's so important. And I always joke that I'm a professional talker, but I'm horrible at shutting up, and it's true, you know, but when I really do shut up, it's when I'm getting good information, especially critical information, because like, that's the stuff I can make. Okay, like, let me digest that for a little bit. Let me go home and think about that. Remember, there's no homework if you don't want to be, right? I'm not in school anymore. And the idea is, my dream wasn't to be a dental student, it was to be a dentist. And I'm living that dream now. And part of that is being able to come home every night and really reflect on the choices, decisions, material choices, patient interactions, things like that.
Without a doubt. So it seems like you got everything kind of all your ducks in a row. Look, man, it looks like you're on top of everything. But I'm
figuring it out.
I do want to ask you, has there been any moments or any things that you know, kind of along your journey that you feel like you could have done differently yourself, or you just wish may have just, you know, turned out a little differently, even if you feel like you did everything right? Maybe just take us through an experience of something that, you know, may have went wrong, kind of taught you a lesson, or again, something that you wish you could have done differently looking back on, I guess, this last year or so.
Sure. I think my biggest one, and something that I'm really been sensitive to now, is like, I'm a new grad, right? I'm the associate, and I want to produce for you know, again, any business that I work for, like, I want that business to succeed. Mm-hmm. I don't want to work at a failing business. Who does? I want to work at one that's prosperous, right? And so it's difficult. Again, I mean, like, all my owner dentists are far older than me. They look much older than me, right? And because, you know, now I'm starting the PDS, that's a little bit different. But at the other ones, they were all owner single dentists that have been the patient's dentist for 10, 15, 25 years, right? And so really kind of understanding patients, and I guess their certain pressures or certain pushbacks on i.e., if we're saying, okay, let's say I diagnose this tooth, and maybe I'm diagnosing, well, there's deep caries, you have, recurrent decay near to that amalgam, I would recommend full coverage restoration for that crown, right? And explaining that. And it's like, when a patient clearly shows this, there's an eye, there's a look, there's a skepticism of like, I don't know about this Tyler guy, right? And maybe, and in your gut, it's like, they're not really believing me. And maybe this is something that's a little above my skill, right? Now I have a really clear cut understanding with my owners, like, hey, you know what? I think she just wants to be, he or she wants to be with you, right? And so I guess whenever my gut is like, I don't do it. And I think that just makes sense for the office, right? Like, I don't care about my production so much as I care about the office's production. And so if I was to do anything differently, which I've now changed, it's really understanding if it's a good idea for me to do it or not. I guess exercising clinical judgment is one thing that I'm really looking at doing. Right. And so, other than that, like, I think, I'm really happy with the way a lot of things turned out. I have certain principles and morals, and I try to stay with those. And I've been happy that I've been able to do that so far. But yes, sure, there's plenty of decisions where I'm like, maybe I could have done this better. Could have not done this better. But I mean, for the most part, yeah, that's my biggest one.
Awesome. So, we live in a age of resources, right? There's so many things, so many YouTube videos, so many books, so many CEs. As a new grad, have you tapped into any resources that you would definitely recommend to other new grads, or any, maybe something that we as fourth years can kind of start looking at, before we make that huge transition into? Do you have anything like that?
Really what I would do is I would just try to engage as much as if I was a fourth year or a senior dental student, engage in conversations with people like myself who are out, right? Like, yes, it's anecdotal, and yes, I know you guys are all evidence-based. Me too. I try my best, right? And I know anecdote or personal experience is the lowest on the hierarchy of good quality data, but it's like what you're talking about feel. You're talking about experience. Right? Like that, it isn't looking at which crown is stronger. No, it's saying what is best for Tyler Brown, future DDS, right? What makes the most sense for Tyrell Freedy to say, this is my best resource. For me, what's worked a lot is obviously communication. Not only that, who's a chock full of information is specialists in laboratories. You got to remember, like, in the real world, money is involved, and when there's money involved, there's people that have what's called skin in the game, right? The idea that they have a vested interest financially and or morally or whatever their reasons are, right, for your success or for your downfall, let's say, right? Any specialist as a new graduate, they should definitely be on my side. Why? Because it's like, as the person with the least amount of experience, right, I should theoretically, right, be sending more stuff out. Is that always true? Maybe not. Depends on the places that I work, right? But it's like, I've really made strong connections with that, as well as dental laboratories. Like, dental laboratories, you know how much they do for us? Like, this isn't dental school anymore, right? Like, I take an impression, it's like, yep, looks good, right? It's like, not knowing, it's like, well, I under reduce, so also I have no ability, because I had a flat tabletop crown. They have no ability to make a nice occlusal. It's going to be a flat, ugly crown, and they have to do these gymnastics. That way my crown works, right? And so it's like talking with them, getting that feedback. It's like, hey, what do you think about my case? I'll write it on the lab prescription, like, hey, please let me know, difficult patient. Maybe the occlusion might not be great. Let me know if I need to re-prep or things like that. And of course, having that conversation with the patient, because the nice thing is the patient doesn't communicate with the laboratory. You tell them like, you know what, the laboratory, like, they really want to make the best crowns. We use the best laboratory, and they just said they need a little bit more room. Is that okay for you? Yeah, sure, of course. What you're really asking, like, hey, do you want a good crown or a bad crown? It's like, I want a good crown. It's like, great, I need to see you one more time.
Yeah.
Right. And so really working with local specialists and the laboratories has been great. I do that through my local dental society. I would highly recommend getting involved. Obviously, my mentors are huge sources of help. Like, let's say I've talked to all my mentors and they understand that, like, hey, if I don't have a patient, do you mind if I shadow you? No, go ahead. Great. So I'll watch them. And then, yeah, like, and maybe sounds cliche, but it's true. Like, I mean, look at what you guys are doing, right? Like, you guys are putting quality content out there. And again, skin in the game and understanding people's intentions. Like, why does FutureDDS exist? Because, again, why am I involved with it? Because we understood what it was like getting into dental school, and it was so difficult, right? And so there are things like dental nachos, dental clinical pearls, et cetera, et cetera. These are free things. I don't pay for them, right? And it's like, think about all the time you spend on your phone on social media anyway. It's like, maybe I can spend that and just like learn like, wow, this is really good to see. And not only that, it's a mental break. Yeah. It's like, oh my God, I got killed on that number 2 crown. Like, oh, so difficult, blah, 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 blah. Okay, great. Now I'm going to go on lunch. Let me just go on Facebook. And then I say, like, oh, full all on X, crazy. And it's like, you know, and so it's, yeah, right. But I think that's important, right? And like, and a lot of these people, they put their time into it, right? And like, again, it's critical feedback. Open yourself up to that. Open yourself up to say like, oh man, you'll see some of them are just nasty on there, right? Mm-hmm. But they're saying that because they have convictions that this crown actually sucks in their own personal experience. Oh, interesting. Okay, I'm reading that and be like, And then of course you start to read and look more at the people who are commenting. It's like, okay, maybe you're just bored and you're just a meanie, right? So like maybe, you know, whatever. But like, yeah, a lot of that. And lastly, what I do is I do pay for Spear online. I pay $139 a month. That was like the new graduate thing. And it's like literally online CE. And so if I have the time, then I'll go plug into that and kind of watch that while I'm earning continuing education. And it's like high quality content. Yep. It comes with an actual, I have an iPad that I take around like at work and it has like chairside videos, which are like amazing animations that basically dumb down all the procedures for me, you know? So that's an amazing tool that I use too. So the 139 is for CE as well as it gives me chairside stuff. So I'm not paid by Spear. I would love to take their money if Spear, you want to make my thing free, fine. But no, that's not a paid endorsement. That's just something that I personally use. That's been great. So yeah.
Awesome, man. So I think that's going to wrap it up for today, Jordan. Dr. Barnett, man, thank you again for taking some time out of your schedule, sitting down with us again. You know, as always, it was a great conversation. Always a pleasure sitting down, man, learning a little bit more every time.
Yeah, absolutely. And I really appreciate your guys' time and I appreciate what you guys do. I think it's really important that us as healthcare professionals can stick together. And I understand that dental school or just school in general can really have a kind of adversarial feel to it, right? Because I want to go to specialty. I want to do this. Oh, it's my patient. Oh, how come Tyrell got a crown and I didn't? Oh my God, Tyler got to 5 extractions. Like, I think we need to keep in mind what the goal is, and the goal is to be competent, and the goal is to learn. And I think even if you're not the one doing the experience, you can learn. Bottom line is it's your money that you're paying. And I can tell you that I got every single penny out of that school that I went to. Did I get the best grades? No. And I have no problem admitting that. But I can say right now that I'm using the information that I used every day. And so far it's been great and I'm living the dream. So I appreciate you guys and thank you for what you're doing for the dental community as a whole. And I look forward to, continue to do more with you guys. Thank you.
Of course, Doc. We'll talk to you soon.
Man, for sure. And also before we go, if any questions for you, man, how could they get in touch with you? Via Instagram, email?
Definitely. That's a great question. So Jordan Barnett, you can just Facebook me. I'm on all the dental things. There's a picture of a fatter looking version of me because I lost a whole bunch of weight. I did the opposite of gaining COVID weight. I dropped a bunch of weight.
Hey man, gotta stay healthy, man.
Yeah, hey, I'm a healthcare provider, man. I can't be unhealthy.
Exactly.
Instagram, I'm not really on Instagram too much. I'm looking to do more, but yeah, Dr. Jordan Barnett, you can find me there. And then or just send me an email, drjordanbarnett, JORDANBARNETT @gmail.com. Feel free, and I'll be happy to talk to anyone who's in dentistry.
Man, thank you. And we'll get in touch with you and make sure we get that link for your portfolio so that everyone else can check that out. We'll put that down in the description. For everyone out there, this is the first episode of a new series that we plan on doing. So stay tuned for the next episodes that are coming up. If you have any questions for us at FutureDDS, add it down to the comments below, or head over to Instagram, follow us on _FutureDDS and send us a DM there, and we can get back to you there. If you haven't already, make sure you hit that like button, the subscribe button, and the notification bell. We'll get back to you next time. Thank you guys. See you guys.
All right, Sharon.
All right.